So we've spent some time discussing the idea, this grand narrative of the US as a global leader, especially in the face of rising competitors. And a key component of global authority is legitimacy. When presented with the same data, a lot of different states have come up with a lot of different, oftentimes conflictual policy responses. And so it's not a question of what the facts are in this case, it's a question of what the response is. How far should US policy be pursued at the risk of losing legitimacy on the global stage? Now, the baseline assumption is you secure your own air mask before helping the person next to you, right? The translation is the US should do what it needs to do to help its people first. But my question is, given recent challenges to US legitimacy and subsequent authority, does that response change? How should the US manage global backlash for its chosen responses, whether in hindsight we believe them to be right or wrong? And how can we prevent those critiques from developing into long-term geopolitical consequences?
Okay, let me see if I understand. You may be too intellectual for me. The question of U.S. response. So one way, before I answer that, part of the answer is that, every country did their own response. Every state in the U.S. sort of did their own response, but most did the same response, and most of the countries sort of did similar responses, not all. The legitimacy that I tried to address in my talk is the lack of legitimacy to the American people. It's the first primary problem here that I see. But you're absolutely right. There is a lack of legitimacy, and this is being shown all over the world. In the UK particularly is one place where there's a lot of sort of similar conflict, and elsewhere. I think that this is a problem that is not going to be easily solved. Okay, I don't want to be too negative, but it's very difficult to undo what's been done here because there is still an obscuration of fact, a lack of transparency in things that should obviously be investigated, like, okay, how did this virus start? I mean, there's just a lack, there is a very strong blockage of information before any legitimacy can be expected, or the inference of legitimacy by people must be made on information. And if we have this situation where we're limiting the information, it is impossible to have legitimacy. In fact, I'm not really answering your questions so much, but one of the most common questions I get based on this is, and I was asked this once at a press conference, and I sort of, it was a hostile environment, so I wasn't very diplomatic, but the question is, who do you believe? Okay, because this is really critical. It's a sort of point one of how you get legitimacy is you have to have experts. You have to have someone to believe. Okay, the word expert has been destroyed, as far as I'm concerned, in the United States, because of the lack of credibility of people who claim to be experts, or who we thought were experts, or who have expertise on the basis of their own, sort of credential per se, and so. It's now incumbent upon individuals more than ever to assess truth. Okay, we cannot rely on experts. This is my own opinion, of course, but I don't believe we can rely on experts. And so the legitimacy must come from your own assessment of the facts. Now, how do we do that if we have a society that does not allow the facts to be out? Okay, now, I don't know how much people are aware of what's going on in the censorship world of social media, and I think we're going to hear some of that, hopefully, with John Yu's talk. But, I get emails every day alerting me to things that were pulled down. I had my own stuff pulled down on YouTube. I had my own things pulled down on Twitter. I would think that people in the United States want to hear what the sole advisor to the president of the United States is on COVID without having it pulled down by Twitter, no matter what I said, let alone the fact that I was quoting all the public health agencies. But the censorship went so far, there was an expert panel by Governor DeSantis in February, me, Kuldorf, Bhattacharya, and Gupta answering press questions, and it was a Q&A on the pandemic, the governor of Florida running it, and YouTube pulled it down. Okay, this is very serious in a country where freedom of speech, there is nothing more important than freedom of speech in a democracy. The country was founded on these individual liberties, and yet we are in a world where somehow someone is categorizing things as misinformation, which it's not, but that kind of freedom is limited. So the short answer is we cannot have any legitimacy, and it's not just the United States, it's all governments, when we are introducing non-fact-based, non-science-based decrees, or introducing decrees without showing the evidence. Even if they were right, we need the information. The public needs the information. There's been a tremendous undermining of government authority in the world, but in the US as one example, not just because of false information or obscuring truth or denying truth, but by government leaders not listening to their own rules. Okay, there is a moral legitimacy that is required to introducing restrictions. Everyone believed in the 15 days to stop the spread, flatten the curve. I don't think there was anybody who really said, okay, no way, we're not going to do that. No, everybody was doing that. But when you have people go, when there's a complete lockdown and you have somebody go and sit and watch the Yankees game as an invited guest in an empty stadium and no one else can go, when you have the governor of California go and have lunch indoors with lobbyists, no mask, when everyone else is under edict, when you have Deborah Birx go and visit her family over Thanksgiving after telling the country you cannot see your family over Thanksgiving. There's a moral legitimacy here that threatens the entire rule of law in the next emergency, in my opinion. So I didn't answer your question because it's not just the global legitimacy of the United States, honestly. It's everywhere, and the same stuff is going on. And if I can be even more long-winded, one of the things that really bothers me, that shocks me, frankly, there were two things that shocked me in the pandemic. One was that besides the people that died and everything, which of course I'm not minimizing, this is very important, but I was shocked that the government had such authority as to shut down schools, businesses, tell you cannot leave your home, all these personal restrictions. But I was even more shocked at the acquiescence of the American people in a country that was founded against that sort of government power, in a country that is known for protesting, in a country that is based on individual liberty. And I look around and I see hundreds of thousands of people in the streets in London, in France, in Italy, in Australia. I don't see that in the United States. Okay, and I think that is very frightening, not just for Americans, but that's frightening for the world. When the United States, the country people go to for individual freedom, millions of people want to come here for individual freedom, Americans are not protesting the loss of liberty. And I just, I'm concerned about that, very concerned about that. Yeah. Does somebody have a mic already? Go ahead, whoever has a question over there. There's somebody in the back.
Hi, Dr. Atlas. Thank you so much. I agree with everything you've said here. I think
you didn't have to say that, by the way.
No worries.
But you're getting the director's award.
I think the best counter argument I've heard, and the one I have trouble responding to, is that you have Asian countries and also Australia, New Zealand, China, Taiwan, who have had unending lockdowns, really, except China, but have had far fewer deaths than here. What is the best way to respond to that?
Yeah, okay, so the question is always, well, what about these countries that did better? Okay, the first situation is that in Asia, there is data that shows that immunity to SARS-2, there's cross-reactive immunity from previous coronavirus infections. There are 4 endemic coronaviruses in circulation now in the United States. There's data that shows from Singapore that 17-year-old blood sitting on a shelf that was exposed to SARS-1 17 years ago has a robust immune response to SARS-2. And that's a sort of a statement to go to the eventual point, which is that generally speaking, Asian countries are highly likely to have some more immunity to this virus. That's point number 1. Point number 2, the only countries that showed any, or states that showed a response to lockdowns in that USC study were 2 islands, okay, Australia and Hawaii. And okay, that's different. And I think we're seeing now rebound in cases in these places that did the severe lockdowns. The virus goes away on the basis of seasonal characteristics and population immunity in that area. Now, what do I mean by seasonal? It's not like every spring we're going to get this, but if you'll notice, these cases are surging in the South United States and Florida, Texas, the same southern states that got it last summer. Okay, it's happening now. We're going to get cases in the rest of the country. This is just the seasonality of this sort of virus. But that stuff is happening. If you look at Japan, if you look at Iceland, their cases are skyrocketing now. Okay, so yes, there's a different sort of baseline immunity. There's a different seasonality, and so when you make a conclusion about something over the short term, like that's been in the news now, hey, Florida's got a lot of cases, they're a disaster. Okay, but you know, it's not true, number one. Number two, we're going to look at the rest of the country in another 2 months. And then the third is it's very difficult to compare different countries. I'll give you the classic example, which I don't have time to go through in my slides, is Sweden. Okay, Sweden, somehow people say, oh, look, they did so badly compared to Finland. Okay, but that's not a legitimate comparison, really. When you look at the data and what Sweden is versus a place like Finland or Norway, there's a tremendous difference in these countries. The northern part of Sweden, what's called the Northland, is very similar to those countries, and they did the same sort of result as the rest of those Nordic countries. But the southern part of Sweden is really much more like other countries, like the Netherlands, like countries with massive immigration. I can show you, I have slides on the immigration flows and all this kind of stuff. It's very different. So these are sort of false comparisons in a sense to make that. But that's why it's much better to look at something that's more reasonable comparison, okay? The United States, okay, we have reasonable comparisons. We're not comparing, you know, South Korea to the United States. I mean, it's just different. So there's so many differences in urban, rural, in population density, in age. This is a virus that doesn't affect everybody equally. It's one of the biggest misconceptions of everything. In obesity, I mean, there's all kinds of data that shows if you look at the life expectancy curve versus percent of obesity in countries, Japan is at the highest life expectancy and the minuscule percent of people who are obese. Obesity is the top 2 or 3 risk factors for death from COVID. We are off the charts with obesity. You know, it's just a lot more. People want to grasp at sort of simplistic assessments, and that's okay because there's an initial, but then you have to think it through, and that's why I say, okay, let's look at Florida. We're in the same country. We saw what they did. We saw what the other states did. Let's look at Florida versus the big similar states. Let's look at Florida versus California, the closest state with the same sort of immigration, the same sort of population. And I think it's a more legitimate comparison. But I could go through the data at some point on Sweden. It's very interesting because they actually did very well. And by the way, no COVID deaths for the last month in Sweden, statistically. Yeah, in the back.
Thank you for your time, Scott. I'm just curious to see these statistics that you showed us. Have they been adjusted for whether the low-income individuals, their occupations were closed down? I think about my mom, for example, who works in the poultry sector, cutting chicken for a living. Her plant was never once closed, even though on a weekly basis, 14 to 20-something of her employees were testing COVID positive. So you do mention that Hispanics, et cetera, they're the ones that suffered most. And you do argue that because of the lockdown, it was a negative impact and the lockdown did more harm. But I just think about the occupations that were quote-unquote essential, such as the strawberry picking, et cetera.
No, this is a very important point that, again, like I didn't put in everything, but this is all part of the statement, lockdowns are a luxury of the rich. The second statement is that, and Martin Kulldorff has said this very graphically, this is the biggest assault on lower income people in the history of the modern era. And why do I say that? Not just because people died with these risk factors, not just because these are people for legitimate reasons who are afraid of getting vaccinated, but because of the policies of the lockdown deeming certain businesses as essential businesses. Because while the people that I was watching on TV doing late night comedy were saying, we're doing our share, wash your hands, they're getting their stuff delivered to their home, they're going to the grocery store, they're going to the meat factories, are their food, the food suppliers, the people working in drugstores, the people driving the buses. All these people were called essential businesses, okay? In my opinion, the most essential business of all is educating our children, and the schools should have been open. Yeah.
Thank you, Dr. Atlas, for talking to us, I guess, this afternoon now. So you kind of mentioned a lot in your presentation about age being the biggest risk factor in terms of if you're going to be hospitalized or potentially die from COVID. You also just recently mentioned obesity being a potential factor as well. I always thought that was a major thing that should have been talked about more, but it seems like in the media, people didn't want to talk about it. People didn't want to talk about getting healthy, staying active, getting exercise. And you also mentioned in your presentation that on average, people who gained weight during the pandemic gained about 28 pounds. And so I guess
the people that gained weight that are 18 to 24.
Yes, 18 to 24, yeah, correct, sorry, thank you. So I guess my question is, how come that hasn't been talked about more? Like, how come people aren't saying people should stay healthy, people should be outside, people should be exercising? How come the media isn't saying, making that more of an important thing in terms of protecting yourself from the virus?
Yeah, I think this is a very, very important question. And it points to this incredible focus on the only thing that we can do is to get a vaccination. And now the CDC said today, by the way, we need a booster shot. And so I don't have an answer to why, but I will join with you in the observation that everything else has been minimized, even though these things are critically important in terms of taking care of yourself. Obesity, diabetes are the two biggest, and they go hand in hand, as probably most people understand, for the health risk factors. These are things that were not just ignored, but they're suppressed. All the work that could have been done in a year and a half on clinical trials of available medications were never done. The clinical trials were not held. After a year and a half. This is unbelievable for anybody who's been involved in infectious disease. So the answer is we have to start fighting to get information out, because the information on how to take care of yourself, there's very good info. I'm not a believer, by the way, in I'm not somebody who pops vitamins and all this kind of stuff, but the data shows that people who are vitamin D deficient are the people who are highly likely to die from COVID if you're hospitalized. And so one of the things that people do when they go into a hospital is they get immediately assessed for vitamin D level, and they get high-dose vitamin D. And I think there are some simple over-the-counter things, as well as taking care, losing weight, not being obese. These are critical, and they are not talked about. And I think your question is something that I will just echo. Why? Why is this not being talked about? I think we have to think through that. I'm going to take one more question, and then we're going to have to go end. Go ahead. I'm going to be around at lunch. You can ask me questions.
So, Dr. Atlas, speaking of things that haven't been talked about very much, I feel like, at least I have not seen a robust consideration of partially because we don't know yet, but the long-term effects of COVID, or even as someone is getting over COVID, the normal, it can take months for their lungs to heal, the health effects of that, and, certain measures that we could be taking to help people, or things that people could be doing to take care of themselves. I was just wondering if you could talk to that piece of everything a little bit.
Yeah. So the term long COVID is what you're getting at. Now, long COVID is something that is poorly understood, poorly characterized. There are some studies that are good on long COVID. And there's a study in Lancet that looks pretty good that says that while there is a significant percentage of people who have symptoms, and these symptoms are vague, typically vague symptoms of headache, lack of sleep, a variety of things, and I'm not minimizing them. But after 12 weeks, 2% of people have long COVID. Okay, so now that's just one study. There are other studies that show all kinds of things. There's a lot of data on similar syndromes like what you may have heard of, chronic fatigue syndrome. And these are things that we don't have a good handle on yet. Things are coming, will be explored by them. But as Sunetra Gupta told me in a phone call the other day, no matter what you think of long COVID, I don't care if the worst part of long COVID is intact. What about all those things about long lockdown? Okay, and so as I put in my book, long lockdown is a lot worse than long COVID, and it's not even close. It doesn't mean that there's no such thing as long COVID. There is, probably. We don't know about the detail of it and the real seriousness of it, but you can imagine it's very difficult to sort out what long COVID is when a lot of the symptoms are overlapped with all the symptoms of the lockdown too. It's very difficult. And then when you add in all the complexity of what was COVID, because you had a COVID positive, a SARS-2 positive test, that's not necessarily COVID. You have to realize more than 50% of people are asymptomatic. People who are over 70, 40% of people with a SARS positive test, 40% of people over 70 with a SARS-2 positive test are asymptomatic. Okay, over 70. So it's hard to say what COVID is and what it isn't. So it's another level of complexity to say what's long COVID. So it remains to be seen as sort of the non-answer to your question. Okay, thank you.